Have you ever wondered how a simple drop of blood can reveal so much about a patient's health, from anemia to infections and malignancies? Today we'll explore one of hematology's most fundamental tools, the peripheral blood smear, its staining, and how we interpret red cell morphology. A peripheral blood smear is a thin layer of blood spread on a glass slide and examined under a microscope after staining. This simple preparation provides a wealth of diagnostic information about red cells, white cells, and platelets. In this video, we'll cover how to make a smear, stain it, recognize normal cells, and spot common abnormalities. We'll use clear diagrams and close microscope images with labeled annotations to make interpretations straightforward. First, specimen quality matters. Use a fresh capillary or venous sample and avoid clots for optimal smear preparation. Make the smear by placing a small drop near one end of a clean glass slide and spreading with a second slide. Aim for a thin feathered edge where cells are single-layered. That is where evaluation is most accurate. Next, staining. Romanowsky-type stains like Wright or Giemsa reveal cellular detail and differentially color cell components. Proper staining time, buffer pH, and slide washing are essential to avoid artifacts that mimic disease. Always examine the smear under low power for distribution, then switch to oil immersion for detailed red cell morphology. Normal red blood cells are biconcave discs about 7 micrometers in diameter, with central pallor occupying about 1/3. On a smear, they appear uniform in size and shape, with smooth margins and no inclusions. White blood cells and platelets have distinctive appearances too. Note their proportions relative to red cells. On-screen term, normocytic means normal cell size, and normochromic indicates normal hemoglobin content. We use terms like anisocytosis and poikilocytosis to describe variations in size and shape respectively. Recognizing normal patterns helps you detect subtle abnormalities that point to specific diseases. Microcytes are abnormally small red cells often seen in iron deficiency and thalassemia. Macrocytes are large red cells associated with B12 or folate deficiency and certain liver diseases. Spherocytes are small, dense, sphere-shaped cells with reduced central pallor seen in hemolysis. Target cells have a bullseye appearance and occur in liver disease, hemoglobinopathies, and post-splenectomy. Schistocytes are fragmented red cells indicative of mechanical destruction, often seen in microangiopathic hemolysis. Inclusions like Howell-Jolly bodies or Heinz bodies point to splenic dysfunction or oxidant damage respectively. Interpretation integrates smear findings with clinical history and laboratory data like hemoglobin and indices. Pattern recognition guides differential diagnosis. Microcytic anemia suggests iron issues, while macrocytic suggests B12 or folate deficiency. Acute infections can show reactive white cells. Blasts or abnormal cells raise concern for hematologic malignancy. Always correlate smear results with reticulocyte count, iron studies, and additional tests as needed for accurate diagnosis. Final summary, the peripheral blood smear is a rapid, inexpensive, and informative test that complements clinical assessment. Subscribe for more practical hematology lessons and review the labeled images to reinforce interpretation skills.